Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Skin cancer is the most common type of cancer. According to the American Cancer Society, almost 5.5 million people in the United States are diagnosed with skin cancer every year. Joining us to talk about understanding skin cancer, prevention, diagnosis, and treatment is Dr. Benjamin Kelly, a dermatologist with the Scripps Clinic Medical Group. He is a member of the Scripps Cancer Center. Doctor, thanks so much for being with us.
Thank you for having me. I appreciate it.
So, talk about skin cancer. Why is it so common? I mean, they say 1 in 5 people will be diagnosed with skin cancer at some point in their lifetime.
That's right, Susan. Up to 1 in 5. And to be honest, here in San Diego, where we have a lot more sunshine than other places, even up to 1 in 3. And that's because there's a lot of sunshine. We love being outdoors here in San Diego. We love surfing, biking, hiking, walking, and we have year-round sun. And so that really makes us more susceptible.
And what causes skin cancer?
Ultraviolet light is the main thing that causes skin cancer. So the amount of light or the amount of sunshine that you've had over the course of your entire life really does matter, and it accumulates. So it's not just what you've had in the past few years. This goes all the way back to your childhood up until now.
So being outside exposes you. What about being inside, for example, let's say on a sun tanning bed?
Yet tanning beds, unfortunately, are not safe. It is direct ultraviolet light, which can cause not just skin cancer, but also sun damage. So any form or any amount of tanning booths actually makes it worse.
And what parts of the body are most affected, most at risk?
Yeah. Well, all those parts of the body that are exposed to the sun the most. So that includes your face, your ears, your nose, and other places like eyelids that we don't think about that much. A lot of us wear sunglasses, but that doesn't necessarily mean that we are completely protected because the light can come from above as well.
So the light's coming down like this, and the sunglasses don't go like this and stop the light from coming in.
Exactly, yeah. And, when it's cloudy out, we don't necessarily wear sunglasses, and the ultraviolet light can come right through the clouds.
So who's most at risk?
So, generally speaking, people with lighter skin tones and lighter eyes, mainly because they're more susceptible to burning from the sun. And more burns means you have a higher likelihood of sun damage and skin cancer.
And talk about the different types of skin cancer. There's what, basal cell, squamous, melanoma. Go through all those different types.
Those are the three most common types of skin cancer. Basal cell is by far the most common. It makes up about 80% of all skin cancers. Thankfully, it's also the most treatable one. The second most common is squamous cell, which you mentioned. That one can be a little more dangerous, but we catch most of those fairly early. And the third most common, which makes up about 1 to 2% of all the skin cancers, is melanoma. And we've all heard of melanoma because it can be very dangerous if caught late. But thankfully, with that as well, we catch them pretty early.
And what are the symptoms?
So each one of these has different symptoms. So basal cells and squamous cells are typically little bumps in places where you're sun exposed, and they can present as spots that maybe just don't heal, maybe spots that are a little bit tender, or maybe a spot that starts to bleed and doesn't quite heal that way. Melanomas, though, those are usually come in brown variants. So let's say, for example, a mole that's always been there that all of a sudden starts to change, or maybe an area of skin where there was never a mole, and all of a sudden you look down and there's a brand new mole. That's usually how melanomas present.
And when you say the mold that starts to change, is it changing in shape, size, or color?
So all the above. So any kind of change in a mole that you've had your whole life can be something that can be alarming. So that's probably a good reason to go get your skin checked out.
Talk about the Scripps Cancer Center. What kind of treatments do you offer to treat skin cancer?
Yeah, so we have a very comprehensive skin cancer unit here. We offer everything from treating small precancers with things like freezing to simple excisions of small skin cancers on areas that are less cosmetically sensitive, like the back. And then we also have Mohs surgery. We are actually one of the biggest Mohs surgery units in the world here. Mohs is great for areas like the face, where we can very delicately go in and take small layer by small layer of a cancer and check it in real time. This gives us one of the highest cure rates, well over 99%, and it also allows us to keep the defects or the scars much smaller. Now, for cancers that have progressed beyond what surgery can offer, we do have radiation therapy as well as immunotherapy.
And immunotherapy, what does that do? That boosts somebody's immune system?
That's right. So immunotherapy is a way to harness a person's immune system to actually attack the cancer itself. It's a very specific way of treating it.
And what is the survival rate if you were diagnosed with skin cancer?
Well, thankfully, we catch most skin cancers fairly early, and so the survival rate can be well over 95%. And that even goes for melanoma. We're very good at picking them up these days. And again, the survival rate has increased dramatically.
Are there things that you can do to prevent or reduce your chances of getting skin cancer?
There are, and some of them, which we all know, like wearing your sunscreen, trying not to burn when you're out in the sun, or don't use tanning booths. Some of the other ones that will include things like wearing protective clothing, such as hats, sunglasses, long sleeves. Those are quite important as well.
And what about sunscreen? An SPF 30, a 50? How often do you put the sunscreen on? I mean, let's say you're, running in and out of the ocean, you're at the beach, or you're at the swimming pool. How
Yeah.
do you handle all that stuff?
Yeah, so what I tell my patients, the number on the sunscreen is not as important as long as it's over 30 as reapplication. All right. So yes, if you're running in and out of the water, if you're biking, if you're sweating a lot, you are going to need to reapply that sunscreen every 2 to 3 hours. So again, the number is not as important as reapplication.
So let's say you're, going in and out of the water. You've got the sunscreen on, you go in, you swim in the ocean for 10 or 15 minutes, and then you come back out. Should you apply new sunscreen as soon as you come out of the water?
Most sunscreens are designed to be somewhat protective from water and sweating. But again, right about that 2 to 3 hour mark is where you need to reapply. So you don't necessarily have to do it every 15 minutes, but really do set a timer, maybe if you're going to be out for a couple of hours to reapply.
And what is the worst time of the day to be out in the sun?
Yeah, so generally speaking, between 10 and 2, those are the hours where you're going to have the highest UV index. And as a matter of fact, a lot of the watches and phones will tell you what the UV index is. So you can look at it in real time, even while you're outside.
When should you go see a doctor?
So I think if something starts to grow on your skin that you haven't seen before, that you're somewhat concerned about, that's always a good reason to go see a doctor to get checked. But we're all susceptible to skin cancer here in San Diego. And I think it's a good idea for most of us to go in at least once a year for a general checkup.
If you don't get a handle on this, what can happen, doctor?
Yeah, so for all skin cancers, the earlier we catch them, the better, especially for the dangerous skin cancers like melanoma. But even for the less dangerous ones like basal cell carcinoma, the earlier we catch them, the less the downtime is going to be. Maybe we can just freeze them off or do a small surgery or even Mohs surgery. But the earlier you catch them, the smaller the scar is going to be and the quicker the recovery.
Any final thoughts, doctor?
Yeah, just remember that we're all susceptible to skin cancer here in San Diego because of the amount of sunshine that we have. The most common types of skin cancer, basal cell carcinoma, typically presents on your nose, eyelids, and ears. So make sure that you're putting your sunscreen on those areas as well. And don't forget your kids, all right, because they rely on you for that as well. And lastly, if you do notice something that's changing, make sure you come to one of your providers and get checked out.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thanks for having me.
If you want more information on understanding skin cancer, prevention, diagnosis, and treatment, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.